Very good afternoon, ladies and gentlemen. You are tuning into the Malacca Manipal Medical College webinar Saturday series focusing on the dentist road to specialization. My name is Barbara, and today we will be focusing on the area of periodontics and oral implantology and prosthodontics. Joining us today, we have two of our professors, Professor Dr. Sunil Kumar, who is the head of the Department for Periodontics and Oral Implantology, as well as the coordinator holding a fellowship in oral implantology, and Professor Dr. Anand Farias, a professor in prosthodontics. Good afternoon, sirs.
Hey, good afternoon.
Good afternoon, sir. Good of you to join us today, and thank you so much. We look forward to your sharing for this session. I'm going to start by introducing you to our viewers today, and we'll start with Professor Dr. Sunil Kumar, who graduated from the Rajiv Gandhi University. He did his BDS there. He then went on to SRM University in India doing his MDS. As mentioned, he has a fellowship and mastership in oral implantology from the International Congress of Oral Implantologists, USA. Prior to running the department in Malacca Manipal, he was also an assistant professor in the Gandhi Dental College, S.B. Patil Dental College, and he was a consultant at various dental clinics and hospitals in India. Hi, Dr. Sunil. Dr. Sunil, can you hear us? We seem to be having a little technical difficulty with Dr. Sunil, but let's move on. Hi,
Hello.
Dr. Sunil. Good of you to join us.
Okay, thank you very much, ma'am. It was a nice introduction.
Thank you. And now we'll introduce Dr. Anand. Dr. Anand, who is also a BDS graduate from the Rajiv Gandhi University in India. He did his Masters of Dental Surgery also at the same university. And like Dr. Sunil, he's done an oral implantology course, but this time from Germany. He's currently a professor at the Department of Prosthodontics at Malacca Manipal, but he also worked in various positions as prosthodontist and implantologist in India and Germany. So good of you to join us this afternoon, sir. We're talking on two areas that I think a lot of aspiring dentists rarely think about. It's not your usual run-of-the-mill braces, that sort of thing, or conservative dentistry. So if you could share with us a brief about your area, and we'll start with Dr. Sunil. Could you tell us what exactly is periodontology and oral implantology?
Okay. Hi, good afternoon, everyone. I'm Dr. Sunil, as Miss Barbara gave me a fantastic briefing about me. And if it comes to my department, we are from Department of Periodontology and Oral Implantology. What is periodontology? It's a part of dentistry, right? So periodontology means peri means around, odonto means tooth, odology means a study of study. So you means structures which is present around the tooth, supporting structures we call. It is in health and disease what we study in periodontology. And comes to oral implantology, now it is a booming area in the world. Now, I mean, in dentistry, most of them either it is a GP or any specialization which they are looking at oral implantology. This branch deals with the fixed processes, replacement of missing teeth. It actually mimics and simulate the natural tooth, crown and root. So in our field, mostly we study around the tooth structures, I mean supporting structures of the tooth, as well as a replacement of a natural tooth by placing an implant. That is periodontology and oral implantology.
Okay, all right. And now on to Dr. Anand, prosthodontics. Dr. Anand?
Okay, hi. Okay, so what we do is basically we come in when things are missing. So when somebody's lost a tooth or somebody needs a little bit of correction here, there, make things look good in the mouth, that's where we come in. So basically we'll deal with crowns, bridges, we give dentures, right? So whatever aesthetic corrections which you want without doing too much of orthodontics, we can do it. So if you want a little bit of whitening, you want some aesthetic correction of your teeth in real short span of time. If things go well, we can do all that. People who come in with pain in their joints, people who have trouble with their bites, we can do a bit of correction also there.
Okay. And
And
it's also interesting that like for birth defects, so you work a lot with babies and things like that.
yeah, there is a when we specialize, we do a lot of what we call as maxillofacial prosthetics. So a branch of it, we will be working with the surgeons, we'll be working with the guys in ENT, the guys working in cleft units and all to give certain prosthetics to people who have all these defects.
Okay.
Like they do a cancer surgery, things are missing. So then we help them build up part of the face, we can help them build up part of the jaws and all that.
Okay, okay, very interesting. And then there are a lot of similarities in the two fields that we're talking today. So let's talk about how do you decide on your specialty? As I mentioned earlier, these are not your common run-of-the-mill like conservative dentistry, pediatric dentistry, and stuff like that. So, Dr. Sunil, how did you decide that this was the field that you wanted to go into?
Okay, actually, so when I was doing my dentistry, and certain areas we feel that okay, I mean we are having a different section in dentistry. One will be good at some artistic area there where they can go to certain departments. Some will be good at this is all we call it intraoral engineering. So in this field, if you see that, and when I start my BDS, and then I develop certain interest into certain areas. Once I finished my BDS, I joined with a group of oral surgeons to do some surgical procedures. And I mean, before joining my masters. And then I discovered myself that I have a passion towards the surgical area. So where I can perform, I mean, surgeries, I'm like fractures and accident cases which come. It you feel that you are not only a dentist and you are working with other specialties like neurosurgery, neurosurgeon, plastic surgeon. When the accident happens, we all sit together, discuss about the case, and then how to go about it. And then I developed my interest in this area. I mean, very very well, and it was a very hectic journey in dentistry. It means we started sometimes cases at morning 5 o'clock, or sometimes the emergency comes, we go at night, midnight, 12 o'clock, 1 o'clock, depends on case. So, but even though dentistry is an elective procedure, but to stabilization of the cases, we need to go at, I mean, even midnights. I mean, there is no time bond for that particular cases to see that, okay, I can come at 9 o'clock, please wait in the office, not like that. So it was a bit of hectic. So after I'm working with them, and then I realized, okay, I'm able to do all these procedures. I have some idea that I mean maxillofacial surgery, how it goes and all. Then I was looking at and which is the future, which is the area which I can perform little bit better, and then which without much stress. Okay, this point I wanted to. I know this is actually a surgical area. You need a lot of passion one side. At the same time, you need a lot of interest towards. I mean, you need to sacrifice certain things at life. When suddenly midnight you got a call, you need to leave your family and you have to run for the case. And then after that, you have to come back, whether you'll sleep or not, we don't know. But again, morning routine, it has to be started. So for that reason, I was thinking, then I choose this department which need a fine surgical skills. I felt okay, surgical aspect, since I have a little bit knowledge on this area, why can't I go with the perio, I mean, the structures are around the tooth are very minimal. See, if you see the gum in a layman terms, if a BDS doctor means they will understand the gingiva. So gingiva, we have only 3 or 4 millimeters which is present there. To handle that, you need a literally decent skill. You cannot work like a surgeon. I mean, we call surgeons as the butchers in dentistry. So butchers in the sense, I mean, in oral cavity, whatever the surgical procedures we do, but we have fantastic blood supply, and we don't need to worry much about it. But comes to perio, the structure which is there 3 or 4 millimeters, you really need to work like a plastic surgeon.
Right.
It is a plastic surgeon's work in dentistry. So
Right.
I felt it okay, and as well as that particular time, implants are just started. I mean, it's not. After post graduation, with my 13 years of experience, and previously maybe around again 7 8 years, which I worked with the surgeons. In this 20 years, what I was looking at is which was a, I mean, future. I mean, which area we can work with less intensity compared to maxillofacial surgery. Then
Yeah.
I thought, okay, maybe this area is going to be future, and then I started my journey towards perio and implants. I joined because of previous experience. I had a decent workflow which I was doing, and this area is make me, I mean, into a put me in a good position after some
Yeah.
time after working on this. That was the reason I took up this particular branch, and so on. Now it's going on, and then I mean, future slides. I mean, like the coming up slides, which I explain about more about this department.
Yeah. Yeah. Okay. What about you, Dr. Anand? It says here
For me,
you love
yeah,
tech.
yeah. Our field has a lot of tech in it. So
Mm,
we have moved on from whatever we did for hand carved stuff, say 100 years ago, and now it is using the latest in what's in the uh, say the IT industry. We have a lot of CAD CAM coming in. We have a lot of materials coming in. We deal with a lot of materials. So
mm,
we have a lot of nanotechnology, a lot of other things coming in. So there's a lot of interesting stuff happening right now. Uh,
okay.
our materials, our crown materials are changing. Our denture materials are changing.
Mm-hmm.
So we are moving in from basic metals. We're incorporating metals like titanium and all that into our practice and into
Right.
our work. And there's
Okay.
a lot of very nice stuff happening. So this keeps us going, and we're always in touch. We can work with other specialties outside dentistry to
Mm.
get things in and basically advance ourselves quite a bit.
Okay. Okay. Interesting. Is interesting because when you talk about dentures, you still think of the lab with all the molds and stuff like that. And
Oh, that's all
someone
changing.
shaving
Yeah, we were just
things.
talking
Yeah.
to a lab in Slango the other day. So they've brought in where now we're going to 3D mill our dentures.
Okay.
Yeah,
Okay.
so
All right.
we just scan them
Okay.
out and we'd have
Mm-hmm.
something like that.
Okay. So, Dr. Sunil, you mentioned that you did many years and stuff like that. Could you go into a bit more in depth in your specialization? And
Okay.
let me know when you want me to play the video.
Okay, just before starting the video, no, actually you start the video. After the video, I can explain them much more. I just wanted
Okay.
to show everyone that where I'm working, what is my university, how I work with my students, and
Mhm.
just wanted to show them first. And after that, I can explain a little bit on that. Please, can
Yeah,
you
I've
start the
seen
video?
you. I've seen you during one of your surgery, and it's a very rock star setup. So we'll share the video now. Just let me get this
Yes.
going.
Miss Barbara, we are missing the voice. The view.
Uh, Okay, Dr. Sunil, that's the end of the
Okay.
video that we have.
Yes.
Um,
Yes.
you know, I didn't know we did such extensive surgeries at Malacca Manipal. So your video is definitely very insightful there.
No, actually, our university and see viewers. I mean, if you see that our university is located at Malacca,
Mm,
and this is the building which where I work. So I'm
mm,
here for almost a decade. Okay, so here we have a very huge setup which Manipal is done. I mean, very good infrastructure for us to do a big surgeries, and we
mm.
have patients all over the world. I can
Okay,
tell that we have patients from Australia, New Zealand, Europe, and Indonesia. A lot of cases which we get it. I mean, referrals. These are all our referrals. We
right,
started in 2011 or 12. So in this setup, if you see, and the thing is, mostly everybody sees that perio means okay. Periodontics means generally, as I said, everybody's thinking is that we just do the cleaning part. So we just
right,
patient will come in and clean the teeth, and then they will go back, and only that is the stuff, nothing else. But perio means we have a lot of things which changed from almost from past 20 years, if you see, there are a lot of things are changed. Previously, yes, only scaling is there in periodontics. But now we add on to the oral implantology, and periodontic surgeries are evaluated a lot. Gum surgeries, especially for smile designs and all, we do a lot of gum surgeries. And in this specialty, we teach them how to do the gum surgery. I mean, aesthetic surgeries, I will call, instead of gum surgeries. Aesthetic surgeries can be done fantastic, and beautiful smile you can create. And dentistry means it's not a one subject. I mean, when we are talking about a department like prosthodontics, orthodontics, everything, we are all interrelationship, if we see. But in perio, we work with the interrelationship with the other departments also, but we concentrate more on gum and implants. Gum and implants, if you see, when we are going towards the gum and implants, these both are have a very unique relationship. And if there is no gum, there is no implant. There is no bone, there is no implant. So it's all together. So and then if it comes to processes, and we, as Prof. Anand was telling, we go with them. And the prosthetic aspect on top of the crown, which they will make that. Surgical aspect, we work with them. And and here, not only the surgeries and not only the processes and not only the implants, we teach our students, if you see in the video, even in photograph, how to take photographs, how to document photographs, and how to check x-rays. Even that is other department, we emphasize on that. X-rays also, we have a three-dimensional machine which is there, 3D. It's a CBCT. So our university is invested hugely on those machines also. Not every place it will be there. So we train our students in that area, and we also get knowledge in that particular area. Since I joined this area of oral implantology, and maybe around 12 years back, I joined one organization called ICOI. With that, personally, I have some benefit because I'm working extensively with them, and they also saw my interest, and then we published some journals, we got some grants with them, and through that, and I achieved a certain recognition from them, like I'm the ICOI director and membership chairman and advanced credential committee member, and I'm an ambassador for Malaysia. These things I got it. What is this ICOI? ICOI is the organization which is based in US. It is non-profit organization. Anyone is specialized in this particular area, they will recognize. So this recognition is the highest recognition in the world. It's the highest, that's why the highest recognition in the world. The only university in Malaysia which is affiliated is Malacca Manipal University. So our Manipal University, which is affiliated, but Malacca Manipal Medical College is doing a fellowship program. I mean, like it's a twinning program, right? So we do a program with ICOI. So we do all the surgical procedure, processes, procedure, theoretical, and all the input which you. It's after BDS I'm talking. After BDS, so BDS doctors want to do implant, they can do this fellowship. So with this recognition, they can practice outside. With this recognition, they can practice outside. And the councils, actually nowadays, if you observe, councils are very, very strict. You cannot practice which is out of your scope. For example, if I do my BDS and if I perform the surgery, I mean fractures of the face or implants, if anything comes under the council purview, any case happens, serious consequences will be there.
That's right.
But if they have done the fellowship with this, and if they have a thorough knowledge and as well as experience, I mean, like they are done through Malacca Manipal, for example, if they have a minor things which a council says, okay, he has experience, and then according to that, the questions will be shoot to the doctor. Even though some minor things, but they won't leave it just like that. But they see that, yes, he got the credential, so he is eligible to do this. After that only the questions will come. If that there is no eligibility and they touch the patients, no, straight away there are no questions. Straight away they'll ask the council to come and give the explanation. No need, no, there is no letters to come and direct call. Only one call will be there. That's where this fellowship programs, which is going to help. And if you come to, I mean, next slide. So here, if you see that this ICOI, and they gave me a lot of mileage as a personally also. And in this profession, I mean, in this particular department, I did my master's. there are certain, I mean, dentistry, everybody says that, okay, I go to the clinic, practice and come back, right? No.
Yes.
Being a teacher, there are a lot of companies in the world. They'll come to you if you are good at in that area. They'll
Yep.
come to you and ask that, can you be do some research for us? Like that. We are one of the organization in the world. We are doing for certain products. We are doing research in our university in
Okay.
Malakka, Manipal. And
Mm-hmm.
we are bringing up the value for that particular product if it is good.
Mm.
And
Mm.
as well as we have some grants for that. So
And the
because,
students benefit
yes,
because,
yes, all our students are,
learning,
because if you
yeah,
see
what,
our students, nowhere else in any university they will teach implantology or grafting procedures, and we are the only university which we allow our student to do periodontal surgery. This is, I can proudly say that we, our students will do periodontal surgery.
before
And
graduation?
yes, before graduation,
Wow.
under the
Okay.
guidance. So they are they are very good at I mean in our subject, because they got the good exposure. When they go to the government, they can
Mhm.
correlate what they are doing.
Yes.
So that is the biggest advantage for undergraduate who are there in Malka Manipal.
Mm. Mm.
So once they come into this area, they can be key opinion leaders for some grafting companies or some
Mhm.
implant companies. And right now I'm doing that. So it's all depends upon their interest and the way how they go towards the profession.
Mhm.
So
Mhm.
there is a wide scope. I mean, don't look at, oh, okay, perio, we deal with only gum surgeries and implant, not that one. So
Mm.
dentistry in this area also, with the research, you can go to another level where you can be a key opinion leader for certain companies, because this is a competitive world in the market. There are, I mean, thousands and thousands companies are coming up with a new material, new aspect. They need a good researchers to identify which material is good, what it is. So
Mhm.
those companies also come on that, okay, you have done a decent research. A prof can be one of our key opinion leader. Can you
Yeah.
do some research on our product? So can you tell us which is going well or not? So we are working as a scientist also in this field.
That's right. That's right. So it's most
This is
interesting.
the
Yeah.
yeah, and as I said, the only our university like Malakka Manipal is affiliated with the ICOI. This is the only university in this country.
Mm.
And if we see that my specialty journey is till now, it is very much. I mean, it's great. I'm
Mhm.
very happy.
Mhm.
I'm looking forward to see, I mean, explore more on this area. I mean, every day I'm sitting and learning and new things which I'm exploring, because everyone knows that life is a lifelong learning. I mean, it's learning cannot be stopped by this age, that age, and now tomorrow to day after tomorrow. Not like that. If you keep on learning things, and you can do much better things. If you
Yeah.
read at this quote, aim for the sky, but move slowly.
Yeah.
Enjoy every step along the way. It is all
Exactly.
those little steps that make the journey complete. So you need to put step by step, so you can reach your destination and your goal.
Yeah.
So
And
I'm
Doc,
very
can
happy
I
to share all these.
can I
Yes,
just say I'm just doing a mental arithmetic. It's been what, about 15 years for you to get to where you are today?
yes, yes. But
Oh.
15 years is not a big time. 15 years means I can say after my post graduation,
Mm-hmm.
13 years. Actually, to reach to this level, not
Mm.
only my own efforts, and at the same time, my university also helped me to reach to
Mm.
this level by providing me certain equipment, instruments. I mean, to
Mm.
practice and work and teach, because of all. I mean, it's a combined effort, and I'm grateful and thankful to Malka Manipal.
Thank you. Thank
Yeah.
you. Okay. And what about you, Dr. Anand? How did you decide that you wanted to go into your field?
When we were studying, we had a lot of collaboration happening in the university.
Right.
So at that time, we had a functioning cleft unit which was doing surgeries for this thing called the Smile Train. So a lot
Mm-hmm.
of free cleft surgeries for poor people was happening. This was run by an organization, charity organization in Germany. So we
Mm-hmm.
had extension to that. We had a lot of other people coming in from around the world training in prosthetics, because the dean at the time was a prosthodontist.
Yeah.
So the prosthetics department had a very good standing, and still does actually. We had the best equipment, which don't think any other college in India at the time had.
Mm-hmm.
So it was a very good place to actually learn everything. Undergraduates had a very good exposure. Even the postgraduate teaching was among the best there. So I basically spent 6 months of my internship in prosthetics because of the
Okay.
work they were able to provide for us to do. So from there, we just it just became a liking, and there was no looking back after that.
Right. Okay. Okay. Yeah. So and you spent some time in Frankfurt as well while you were doing your
Yeah,
masters.
yeah, because we were tied up with Frankfurt, Goethe University with Frankfurt. So we had professors coming down to take classes in implantology and prosthetics also. So what they gave us the option that as you're doing a master's in prosthetics, join up with this, and you get to do that also at the same time. So it worked out very well for us out there.
Was it very different, the experience? I mean, the hospital setup, the patient care treatment, what did was that an eye-opening experience for
It
you?
is an eye-opening. It's totally different the way they function and how things are supposed to be done. The way they say, because the person in charge of our course and my examiner also, he was the one who holds the patents for certain implants which are used by the Dentsply company.
Wow.
So he was pretty strict. Even the
Okay.
prosthodontist who conducted the exams and who was our mentor there
Mm-hmm.
was very strict. You remember case reports going out of the door if he didn't like the way things were done.
Okay. Okay. But
So
it's
yeah,
good, isn't it? I mean, because then that exposure basically told you how high the benchmark was. And
yes,
and now in your teaching and your practice, I believe you're still pegging everyone to that same benchmark.
yes, we do that. We expect a certain level, and we want people who pass out from Malacca Manipal to be at that level.
Okay, okay. So we couldn't have had a better pack there. Okay. Now let's talk a bit about the pros and cons of your areas. And we'll start with Prof. Sunil. What are some of the pros in your areas?
If you see this, I mean, as I said, there are a lot of benefits, which because we deal with the I mean, every department has their way of telling that we are good and this thing. Basically, dentistry is a very good subject which we can talk on it. And
Mm,
preservation and supporting structures, okay, and then benefits during implant rehabilitation and patients for lifelong clinical practice. In our area,
mm-hmm,
a patient comes today and we want the patient to come back after 6 months, 1 year. This is called supportive periodontal therapy. They'll be constantly in touch with us, so
okay.
they'll come and they'll get the cleaning done and see that any minor problems is there we are come to play a major role, that saying that okay, you have small cavities are there, please go to conservative and endodontic department where you can get your treatment done.
Mm-hmm,
Or if there is a suddenly tooth is completely decayed, and please go for extraction removal, and from there you go to prosthodontic department where you can get your replacement of your missing tooth, either removable denture or a fixed denture or whatever it is. Or if they are really okay with the financial aspect, then we will convince them towards the implants. So these
mm-hmm,
are the major benefits which is there in perio, because patient, as long as they have teeth, they will
mm,
come to us every 6 months. I mean,
mm,
if you see the United States and where the insurance play a role, it's mandatory to see the periodontist or dentist every
okay.
6 months. So
Mm,
that's where we comes into that. And come
yeah.
to
But it doesn't work that way in Malaysia, isn't it? We only
but
go and see you when we have pain.
but awareness is increased a lot. Awareness is increased, I mean, compared to, I mean, like when I started my dentistry, that time there are only two things: extraction and then a replacement of teeth. That's all. Nobody bothers about cleaning, nobody bothers about filling, I mean, only tooth, right, and all. See now, after a journey almost 2+ decades, and I can see the lot of awareness is increased on patients, where I'm seeing you don't need to call also nowadays. They are coming because of
Mm,
education system, or because of the this the Facebook or communication system, which is increased a lot nowadays. Everybody are understanding the importance of the teeth. Without that, I'm like they can't have a good food, and without that they can't have a good smile. A lot of implications on that. I mean, because of that area, people are coming to dentist. There's no doubt about it. It's increased a lot. But in
mm,
perio, biggest disadvantage, if I see that, it is our diseases are painless diseases. Patient doesn't know that I'm like he's having that particular area. And if they won't visit and awareness is not there and the risk is increased, and by the time they come to us and we may not able to save the tooth and all supporting structures would have gone, and it was very difficult to retain the tooth, and then we have to do some procedures which involve a lot of cost, and some surgeries we need to perform. And certain areas, some patients might accept, some patient affordability will be there. So these are some disadvantages which patient comes in a last stage, and like we call advanced stage, right? So in that aspect we have some disadvantage, but due to awareness I can see that a lot of advantage for the dentist nowadays. I'm not looking at a department, but overall dentistry awareness is increased a lot.
Yeah, yeah, yeah. And Dr. Anand, prosthodontics. I always associate this with old people, like when your tooth can't be saved anymore, and one always thinks of one's parents. I know my mother has lots of issues with her dentures, but is that the only thing helping an older patient? Is that the only joy there?
No, no, no. We deal with the whole spectrum, like from people say at the age of 18 right up to the very, very old. So there are a lot of challenges. Each age group would have a different expectation from us. So there are a lot of things which we have to take into consideration. The old people, yes, they have a lot of expectations. Things
Yeah.
get very difficult when we have to make prosthesis for them,
Mm-hmm.
but it is a challenge.
Mm-hmm.
Young people are more worried about aesthetics and they're very, very, very critical. So again, over there you have to be really, really good. One mistake could cost us a lot, if not them.
But do you think that do you think across the age group, Dr. Anand, it's a balanced mix of patients that you're seeing?
Yeah, if you take the whole sample across, yes, we could see that. A
Mm-hmm.
lot of people are now moving towards more of aesthetics over function,
Mm-hmm.
the younger age group at least.
Mm-hmm. Mm-hmm.
The old ones still want to just be able to eat. But
Yeah.
we have
Yeah.
had people coming in at the age of 80, 85 and saying, we have to look good.
Oh, okay.
Yes.
Okay,
uh,
that's
may,
interesting. Yeah.
Yeah.
I think, what at the earlier on in our series, we had the speakers from conservative dentistry and things like that. Do you find that both your area, right, like oral implantology and prosthodontics, are y'all at crossroads with the conservative dentistry people?
We
Miss
really
Barbara.
can't move without them, actually. It's also all goes hand in hand. So we need them uh, to help us out, and we
Mm-hmm.
really can't. If a lot of stuff which we do, we have to consult with them first.
Mm-hmm.
We take their opinions, and if they give us a go ahead on so many things, we go. Then only we proceed. A lot of stuff which they request us, we have a look at it, and then we work hand in hand.
Okay. Dr. Sunil, you were going
Yeah,
to say something?
I want to add one point as
Yeah.
Prof. Anand told. See, actually, we are dentists first, so
Mm.
that is a broad spectrum. Okay, all the departments comes under dentistry.
Mm.
After that, we are going in depth. So, if you see that a patient comes to a dentist and he should able to handle everything, aesthetics or function, both has to be handled by a dentist. And
Mm-hmm.
in certain areas, for example, Anand told that I mean geriatric patient, I mean old patient who comes there, and for them previously they said, okay, I need a just denture, okay, function is better. Nowadays the things have changed a lot because of awareness, and people are looking at I need a function which is fixed and as well as aesthetic at the age of 80, 85. Do you believe it?
Mm.
Yeah,
It's a
it's
bit hard.
happening. Yeah, it's bit hard. There are so many reasons for that. That's what I just want to add. That point is, we deal with when in oral implantology, we have a lot of patients who comes at that age. The dentures, what they do, certain patients who used for we are all we call unilateral chewers. Only one side we eat. I mean, if you observe or not, when you are eating, when natural tooth are there, so we eat one side. But
Mm-hmm.
it comes to denture, it is you cannot eat like that. You should eat both the sides, right and left at the same time. You need to bite.
Mm-hmm.
So certain patients they said that no, I can't do that. I need a fixed, and at the same time I need a good aesthetics. So there the oral implantology will play a role And even though you don't have a bone, for example, when you reach at the age of 70, 80, and this bone is a different bone. This is called alveolar bone. So when tooth is not there, automatically it will disappear from there. It goes and deposits somewhere else. So that's why when we are dealing with implantology, we ask them, please get the extraction done by us and place the implant immediately. Don't get the extraction somewhere and come after 1 year for implants. Your bone won't be there. So we are doing immediately now after extraction. But patients who come at the age of 70 and 80, 100% they would have lost the tooth somewhere else. I mean, some other dentist and somewhere they would have gone and they come finally. I got my dentures done. I'm not comfortable. I need a aesthetics and function, and there is no bone. That particular area in dentistry we call zygomatic implants, where we use the a bone next to your eyeball,
Sorry,
next to
did you
your
say
eye,
eyeball?
next to your eye. There is a
Okay.
bone called zygomatic bone. That bone also we anchor the implant and bring the towards your oral cavity inside. Okay, inside we bring it to your oral cavity and we fix the teeth. So that is the beauty of dentistry nowadays. I mean, it is transformed into so many areas.
Wow. I'm
I mean,
sorry. My if you can see me now, my jaw is just hanging because it's
no, no,
like
no, no. That's a different. But I'm talking about upper
yeah, the upper round.
area, upper area. So upper denture, if we are placing, if patient is not comfortable with the denture, they want fixed, but still they don't have a bone,
Yeah.
and we have an option where we can take a bone support next to your eye. That is called zygomatic area. There we anchor the implant and bring back to your oral cavity inside, and then we can fix
Wow.
the teeth. So the dentistry is gone to another level now. So that's why it's true. I mean, what we teach our students, what Prof. Anand was also explaining, there are so many new things are happening now. CAD cams and milling units and different materials. It's a lifelong learning.
Yeah.
Previously, the dentist will do. I mean, if I'm not mistaken, if you ask your mom, I mean, their dentist will do. They when you go pain, remove the tooth and put it in dustbin, and then after that again they have pain, go remove the tooth and put it in dustbin. They don't think about how to replace that and how to restore that. Now things are
Yeah.
into a different level. That's why any patient comes to dentist and first they say function,
Mm.
without a second thought you should know about aesthetics also. If
Mm.
there somebody says I want only aesthetic, function is not there also, doesn't matter, and after 3 months they'll come, doctor you put me, it looks very nice but I can't eat. So it
Yeah.
means function and aesthetics goes together. It is not
Yeah.
separate.
Yeah, yeah, exactly.
So
And a lot of people they tend to forget that as how important the teeth, the gums, the entire mouth structure is, because that's as long as you're able bodied and stuff like that, that is where your source of nutrition goes in from, right?
exactly. 40
Yeah.
years back, if you see, there are no 40, 50 years back, in certain countries, there are no dentists. MBBS doctor used to do the extraction.
Mm,
After that, only this specialty is well developed in all the countries. I'm talking
mm,
about most of the countries now. Dentist is a profession where a dental surgeon will come and extract the teeth and replace the tooth and give the fixed processes or implants. And it's the 3 millimeters of gum also one specialty. I mean, depth is increasing.
mm-hmm,
Not only the broad area. Broad area means all the departments in dentistry. Depth
mm,
means each subject, I mean, each department, we are going to a certain level. We are
yeah.
restoring every part of the oral cavity. I mean, without losing the natural structures. Natural structure is naturals, right? I mean, like instead of
Yeah.
bringing the artificial one. That's the main role
Mm-hmm.
what dentists are doing now.
Yeah. And Dr. Sunil, do you deal with adult patients only, or do you also deal with pediatric patients?
Oh, okay. So if you see that, I mean, uh, till I mean, Malaysian this dental council and Ministry of Health, what it is given is, we have a pediatric dentistry.
Yeah,
Pediatric dentistry can deal with up to 18 years.
that's right.
Okay, after 18 years, rest all the departments will come into dentistry. That's why
Mm,
if you see the similarities, in dental procedures, rest all the departments what we do, all the procedures for the kids is done by pediatric doctor, pediatric dentist. So they will take care of filling, so they will take care of
Yeah.
cleaning, they will take care of extraction, removal of the deciduous tooth, milk tooth. So all that is done by pediatric dentist. Anything after 18 years, which is comes into different specialities. Below that, all the patients will go to pediatric dentistry.
Okay.
And if it comes to implant, it's a mandatory only after 21 years only we will touch. The
Okay.
reason is the skeletal growth we call, not the
Mm-hmm.
mental growth. It's a skeletal growth. The body, the skeletal, especially face and that area, the skeletal growth will be there up to 21 years.
Wow.
Yes. So if you do an implant around 16 years or 14 years or 15 years, and that particular time function and aesthetic what you see, after 4 years it will change. So you
Mm-hmm.
cannot reposition the implant. You cannot take out the implant and put it in another position, right? That's
Mm-hmm.
why. So we deal oral implantology department after 21 years,
Mm-hmm.
not before that. And comes to perio after 18, periodontics after 18 years, we deal with perio treatment for the patients.
Okay. Okay. So I suppose, if there's any things like that before a patient reaches the age of 21, Dr. Anand, they would be in your field then
Uh,
for replacements and
yeah,
such?
they would come to us, yes.
Mm-hmm. Mm-hmm. Mm-hmm.
Yeah.
Okay.
We
Okay.
wouldn't touch, like Sunil said, we wouldn't touch any patient who's still below 18. We'd refer them to the periodontist.
Mm-hmm. Mm-hmm. Okay. Okay. I have a question for the both of you. Has there been an instant, because like for example, if a person's tooth needs to come out and they have to decide, and cost is not an issue, but they have a choice between doing going straight for an oral implant or just a simple denture, or even if the tooth can be salvaged, they can do a crown. Have the both of you been in a situation where a patient cannot decide and have asked you, okay, can you help me decide, and you had to pitch for it?
Okay, this particular situation is very, very common nowadays. Very, very common. Everyone will come and ask about it. Financial concern is not there. I think both of us will prefer the patient go for the implant because it mimics the natural tooth. It
Mm,
exactly like natural tooth. It's like a root and crown. So root comes under as a implant and the crown comes as a crown. So
mm-hmm,
in that aspect, so we suggest our patient to, because you are talking about a patient who doesn't have a problem with finance and looking for a natural function how it was before. So most probably, I'm assuming even Prof Anand will go for the go with the implant.
Yeah.
Dr.
If
And
Anand, can you
money's
take
no
that?
money's not an option, not a problem, then yes, I guess. Yeah.
Okay, okay. Don't mind me asking, what is the price difference? I mean, let's put the cost number out there. I mean, how much are dentures today? How much is a crown, and how much is an oral implant? What kind of
no,
gap are we talking about?
okay. Actually, one thing what you have to understand is, instead of comparison between the removable and fixed, and there are advantages and disadvantages. First, okay, if we do a denture, okay, you need to remove every time before you are eating. If it is in the posterior, behind molar area, otherwise it will break. So that
Okay.
is the biggest disadvantage. And second thing, which is that if they do the fixed processes, means the bridge they do, they need to trim the natural tooth which is adjacent to the where the missing tooth is there. One tooth is this side or that side, depends on the situation how many teeth they need to grind, and they are going to decide on that. And comes to the implant, even though it is a bit expensive, and we are not going to touch anything, and we are straight looking at the bone quality and gum quality. We straight place the implant there and tooth is coming out. So it looks 100% like a natural tooth. So the comfort levels also you cannot compare between these three. I mean, if you see the removable denture and you can see the bridge, and then you can go for implant. Comfort levels is so in that if you put a scale, because instead of I'm putting the price, price is very difficult to tell from each dental clinic, dental college, and everywhere. I can put the scale. If you see the denture which cost maybe in the scale number 2, and in terms of price, and then comes to the what is it, our fixed bridge is cost number 5, and implant might cost at number 8, 9, 10. So you can compare that. I mean, that is a comparison I can tell instead of giving the figures.
Yeah, good one, good one. I suppose it's like a car. I mean, everybody knows a car gets you from A to B.
Exactly. You're right, because you can drive Myvi, you can drive Merc, BM, depends on your comfort. I mean, affordability, you can choose what you want. I
Okay.
agree with you.
Okay. Dr. Anand, anything to add there?
Oh no, Sunil actually hit the thing on the head. Yeah, so that's exactly how we should go.
Okay. All right. Great. Okay. Now, in wrapping up, any words of wisdom you have for our viewers tuning in today? Dr. Sunil, any words of wisdom?
Um, I tell choose wisely where which area you want to go, and you look at the scope. And like most importantly is what is your interest. It's not that okay, this particular department, if I do I can earn more, if I do this is more comfort will be there. That is I mean, you should keep that is a last preference. First preference is what is your interest. And where because when you do your undergraduate 5 years, I'm sure everybody will have their interest. I am good at art, I might go for prosthodontist. I am good at a surgery, I mean I can go for surgical procedure. I have a more stamina to work, they can choose some other department. I'm good at minor things which I can do, like a plastic surgeon, they can come to perio. Or the endodontist, I'm very good at art on the tooth area, crown area, they can go for endodontist. Depends, okay, what interest and what I mean, in which area they are very good. So that is the most important thing which they need to see. And after that, I mean, ma'am, can you put another slide? I just wanted to viewers to see the, I mean, see the same thing only what I told. They have to enhance their clinical skills and keep polishing it. I mean, like they have to perform more number of cases when they are doing in undergraduate. So then only they will identify their specialty. Yes, I can go for this, I can go for that. And the knowledge. So you need to update compulsory that it's not a, if anybody comes to a medical sector, either MBBS or dentistry, and they need to update day-to-day basis. They cannot keep quiet. Especially dentistry, I can tell more because there are a lot of materials and instruments and techniques are changing day to day. And whatever the material I used, I mean, 6 months back, today is another material which is there in the market, and I should know, right? Without reading, without updating, I cannot use that material on patient.
That's right.
And as well as technique. Technique is more important. N number of techniques are came in to make a dentist life is easy. And before we want to do unscaling, you believe it or not, we used to do 4 hours, 5 hours, 3 hours. Patient has to open their mouth and keep, because I use only hand instruments, nothing else I have. 20 years back, I'm talking. So I have to take one instrument and keep removing the tartar from the tooth surface. It takes, I mean, plenty of time. And now I can finish in 15 minutes, 20 minutes. We have ultrasonic scalers, which there in the market now. Those instruments, so it is, we need to update ourselves with the material, instruments, and technique. That is. So knowledge is king. So you need to help yourself, serve your patients in a better way. You need to have a better knowledge, whatever you are doing. So that is my advice. And then decide your department and what exactly you want to do it. I mean, if you say that undergraduate level, in foundation in science also, we teach in Malakka, Manipal, that a little bit of dentistry and what we do here and how to go about it. And then some medical subjects also they will teach. And then from there, they will pick up that idea that, okay, dentistry means these are the things will be there. And when they come to dental, and then further we teach them the till they reach year 5, they can identify themselves that which specialty they can do in a better way.
Yeah.
So it's all depends on each student. But this is my sincere advice: work hard, update your knowledge, practice more, and gain knowledge. Then treat the patients. Don't treat the patient without knowledge.
Okay, thank you.
Yeah.
Dr. Anand?
Yeah, along the same lines, yeah, they should get into something which they really like. Otherwise, they're not really going to enjoy it. And once they do that, they have to get into the core of things. There's no point sticking to the basics. All the fun lies in when you dive deep and realize what's happening in the field.
Okay, all right. Thank you so much. Thank you so much, sirs, for joining us. For our viewers, you're tuning into the Malacca Manimal Specialist Program focusing on dental speciality. We offer a Bachelor's of Dental Surgery, BDS, which is a 5-year program, 1 intake a year. So our next intake is actually starting early of October. If you're still shopping, get in touch with us. We'll tell you how at the end. We've got a limited quota of 75 per student, 75 per intake. And starting from October, the program will actually be held in Malaysia, where your first 4 semesters would be preclinical theory, and semesters 5 to 10 onwards would also be held in Malacca, where we have a clinic that sees over 30,000 patients. So, if you're still shopping around, get in touch with us. We are one of Malaysia's oldest and most private established medical and dental college. We have a on-site dental clinic that sees over 30,000 patients a year. We're located in Malacca, 90 minutes from the capital of KL, where all your patients welcome you as one of your own. And we've got globally experienced faculty like Dr. Sunil and Dr. Anand, who will assist you in preparing for the specialization and destination of choice after your BDS degree. We're going to take some questions. I think whatever questions has been covered, I've been able to throw that into the mix during our conversation, sir.
Okay.
Anyone has any last questions? Feel free to use the chat feature. I think both our professors have given you a lot to think about today, and we hope you have enjoyed the webinar. Thank you so much again, Dr. Anand, Dr. Sunil, for joining us. Definitely very insightful. I, for one, now know more about your fields of specialization. It's more than just dentures or replacement of tooth. Is the whole function of the mouth and making sure it works as best as it was the day that we were born with. Yeah, so thank you so much again, sir.
Thank you very much, man.
Thank you.
Yeah.
Thank you for having us.
For our viewers, if you have not followed us on Facebook, please do so. It's Triple MC Malaysia. I repeat, Facebook, Triple MC Malaysia. A dentist always gets to the root of the problem. We hope all of you would. Thank you so much again. Have a great weekend ahead.
Thank you.